Ladies and gentlemen, gossip day for town.
The Nigerian Medical Association (NMA) wants improved testing and specimen collection methods that will improve the credibility of Nigeria's COVID-19 numbers. The NMA thinks the COVID-19 figures released each day by the Nigerian Center for Disease Control (NCDC) may not reveal the reality of the pandemic in the country.
Recent controversy over COVID-19 testing conducted by the Nigerian Center for Disease Control (NCDC). Even the Nigerian health authorities are worried that the testing numbers compared to the country's population is far below what is expected, a situation that has been largely due to lack of adequate samples and testing materials. As at Saturday midnight, 16th May 2020, the number of new tests stood at 1,028, bringing the total number of samples collected and testing to 33,970. From the previous days, we had 1,240 as at Friday, 1,045 tests were conducted on Thursday, on Wednesday 1,249 tests done, and Tuesday 990 samples were collected and tested. Even though there was slight increase in sample collections, the Nigerian Medical Association says the figures were far from what is expected in combating the COVID-19 pandemic.
In 30,000, we have 5,000. Then it means if we extrapolate to maybe 2 million, then you can see what we can have, which may be very, very high, looking at the percentage of those positive with those very few number of people tested.
The NMA says using innovative specimen collection and transport modalities is what is needed to better the challenges in the process.
We have told the government severally we must increase the testing rate. We must find ways in which we can quickly identify those who are positive, get them out of circulation or out of the community so as to debar them or to disrupt the transmission from person to person. It is at that time that we will say, yes, we are working towards containing the COVID-19 transmission in the country.
The struggle to get testing up to a higher level has led more Nigerians to cast doubt on the capabilities of the Nigerian government in bringing COVID-19
be great again.
Never! I said never! Never! Nigeria will never be great again. Never in the history of this world. I was one. Will you keep quiet?
People are making noise about coronavirus. To me, it's rubbish. Malaria. Did you make noise about malaria? Malaria kills more people in Nigeria than coronavirus. Every day people die of malaria. In the villages, they die. So what are we talking about coronavirus? Closing border up and down for what? And Nigeria doesn't even have it. I don't think Nigeria has it. Because you've heard Dr. Kwesi say that they say he had it. It's malaria tablets they give him. So if it's coronavirus, why would they give malaria tablet? Nigeria, they are using it to eat money. Eat money. Governors eat money. Corporations eat money. They tell lies. They take money from federal aid government. They take money from aid associations. They don't have malaria overseas. Nigeria, they are already used to malaria. So corona cannot attack the people who have malaria. Nigerians are already heavily, they are malaria themselves. So is it corona now that we, my friend? Nigeria, the people who are happy, I don't think they are up to the number they are calling. The number they are calling, I don't think is the number. When one person have high temperature, fever, now they say it's corona, quarantine him. 56 people have been taken, 10 people, 20, 50, 46 have been discharged. Where they treat them? Okay, River State now have no center. Many states don't have center, but they are discharging people. So where are they discharging them from? They don't even have testing kits. Yeah. So where did they discharge them from? Just have funny test, my friend. Read Bible. So corona will not come near you. It won't come near you in Jesus' name. I read Bible, so I'm not afraid of corona. I'm not afraid. Read Bible. Read what? Every time you see, you even give the analysis more than the doctors. You talk as if you're a doctor. I said, one day I said, you're not a doctor. Are you not a medical practitioner? Why are you talking like this? Some of you, you've read the tip to a point. You're even afraid. Even when you move like this, the thing moves you like shadow. It follows, news, words have power. We have to hear power. Some of you, even in your sleep, you see that like clown. When someone say, he said, oh boy, he's sneezing now. Oh boy, why are you sneezing now? Why are you sneezing? Why are people not sneezing before now? Somebody even want to make her like this. Say, no way, oh boy, don't shake anybody. Oh, don't shake anybody. Oh, this coronavirus.
Of things that you don't just complain. You don't just sit back and
Just the little things you can.
one of the most shocking things that I've still seen is that as of today, some people still tell you that there's nothing like COVID-19. But the people who believe it, all of us, we do our bit to make sure things get better.